Question 1. The Clinical Documentation Integrity (CDI) Manager has noted a query response rate of 60%. The CDI practitioner reports that physicians often respond verbally to the query. What can be done to improve this rate? Question 2. A clinical documentation integrity practitioner, CDIP, hired by an internal medicine clinic is creating policies governing written queries. What is an AHIMA best practice for these policies? Question 3. The ultimate purpose of clinical documentation integrity, CDI, expansion and growth is to blank. Question 4. When there is a discrepancy between the clinical documentation integrity practitioners, CDIPs, working DRG and the coder's final DRG, which of the following is considered a fundamental element that must be in place for a successful resolution? Question 5. Which of the following may make physicians lose respect for clinical documentation integrity, CDI, efforts and disengage? Question 6. A clinical documentation integrity practitioner, CDIP, is developing a plan to promote the CDI program throughout a major hospital. It is proving challenging to find support. What is a primary step for the CDIP? Question 7. An organization dealing with staffing shortages has adopted a policy requiring clinical documentation integrity practitioner, CDIP, to stop reviewing any record after a major complication or comorbidity is found. What is the unintended consequence of this? Question 8. Which factors are important to include when refocusing the primary vision of a clinical documentation integrity, CDI, program? Question 9. The provider was queried because the patient met clinical criteria for acute hypoxic respiratory failure. The response to the query was different than what was expected by the clinical documentation integrity practitioner, CDIP. What should the CDIP do? Question 10. A pressure ulcer stage 3 is documented in the progress note. The clinical documentation integrity practitioner, CDIP, has queried the attending regarding the present on admission status of the pressure ulcer but has not received a response in an appropriate time frame. What should the CDIP do next?